My name's Jen. I'm a student physical therapist. Would it be all right if I felt some structures on your hips, on the front, and then on the back of your buttocks area?
You may.
Thank you. So the first thing I'd like to do is feel for your iliacus. So I'm going to find your ASIS, which is right here. And if I hook my fingers around, can you lift your knee up towards the ceiling for me? Thank you. And then back down, and I can feel that fiber contract there. I'm going to come off the side a little bit and find the TFL, which is right here. Can you turn your toes in towards your other leg? And those fibers contract. I'm going to come a little bit further down, not quite to the greater trochanter, and I'm going to find the glute medius and glute minimus. So I'm going to have you push out into my hand for me. Thank you. And I can feel those fibers contract right here and relax. And then the next thing, I'm going to feel your adductors. Is it okay if I feel up towards your groin area to check the tendons there?
You may.
Thank you. So we're going to start down here. Follow the adductors. And then up here is where I can feel that tendon. I'm going to have you, can you pull your knee to the other knee? Thank you. And I can feel the adductor group contract and relax. I'm going to go ahead and put a bolster under your knees. And then I'd like to find your rectus femoris. Go ahead and relax. So I can feel the fibers down here close to the quadricep tendon. If I have you extend your foot, I can feel that contract and then relax. And then as I go up, I'm going to find the AIIS. And I want to make sure I'm not on the ASIS. So there's the ASIS. Here's the AIIS. Then I'm going to have you lift your leg again up towards my hand, and I can feel that fiber contract. Relax. Now I'm going to go to the vastus medialis. So I come around this way. They come like this, and I'm going to strum across the fibers here. And then I'm going to have you straighten your knee for me, and I can feel those contract under my fingers. The next thing we're going to do is, if you don't mind, I'm going to have you lay on your side, and I'm going to put a pillow between your knees. And then I'm going to feel on for your vastus medialis. I'm sorry, vastus lateralis. So if I come right here is the biceps femoris tendon. Come a little bit this way, I can find the IT band. So what I'm going to have you do is lift your leg towards the ceiling, and I can feel the fibers around the IT band contract, relax. And then if I come a little bit further in front of that, anterior, I can feel the fibers of the vastus lateralis. And what I'd like you to do is if you would kick out towards my hand, thank you, and then relax. And we're going to find two more structures, but these are on the back side, so if you could lay on your belly for me. And then we're going to find the glute maximus and the hamstrings. So the fibers of the glute maximus run from the lateral border of the sacrum and the border of the iliac crest, and they kind of run in this fashion towards the greater trochanter. So I'm going to strum in this direction. And if I can have you lift your leg up, I can feel those fibers contract. And finally, we're going to find the hamstrings. And so I can trace them up to the ischial tuberosity, and then down. If I go medial, I find the biceps, the semimembranosus and the semitendinosus, and if I go this way, I find the biceps femoris that wrap around. As I feel it as a group, I'm going to have you lift your leg, and I can feel the hamstrings contract.